Next up, we have a story about a 200-million-year-old bioreactor. And to present that story is somebody who's been attending SynBioBeta for many years and is now welcome to the main stage. So please give a big round of applause for Sam Levin, the co-founder and the CTO of Neion Bio.
I first came to SynBioBeta in 2021, and this was how I envisioned the world of synthetic biology. I imagined streetlights lining our highways made of bioluminescent plants, skyscrapers built from living fungi, and medicines growing on trees. And then I came to my first commercial biotech company. And I saw this. We make over 90% of our biologics in giant steel tanks or single-use plastic bioreactors using Chinese hamster ovary cells. The way this works is we take the ovary cells out of a hamster, and then we rebuild the hamster out of steel and plastic and media and filters and pH sensors. The biologists in this room will not be surprised to hear that doing this is wildly inefficient. In fact, it costs hundreds or even thousands of dollars a gram to make biologics this way. The facilities for these bioreactors cost hundreds of millions or billions of dollars. And the inputs to run these bioprocesses come from all over the world, largely outside the US. Everything from media to pH sensors to filters to growth factors, right? Basically all of the things it takes to build a hamster. And there's hundreds of these inputs. This inefficiency is not for lack of imagination or lack of trying, but because we have been hampered by our bioengineering capabilities. Right? The history of synthetic biology the last 50 years has been that we've had a handful of cell types and organisms that we've been able to bioengineer. CHO cells, Chinese hamster ovary cells, are not incredible protein factories or even particularly good ones. They were the cells that we were able to engineer. And so the process has been use the cells or the hosts that we can work with, that we can engineer, and then compensate for their deficiencies with expensive infrastructure and hardware. But that no longer needs to be the limitation, right? Bioengineering has come a long way, right? We've now combined, gene networks from fungi into petunias to produce glow-in-the-dark plants. We've put a dozen edits into a pig to grow human organs for transplants. We've combined 20 edits in a single organism to bring the direwolf back from extinction. So at Neion Bio, we asked ourselves, what if we were to start over? Right? What if we were to reimagine biomanufacturing from the ground up using the tools of today? If the bioengineering tools of the 60s brought us E. coli, and the tools of the 80s unlocked Chinese hamster ovary cells, what could the engineering tools of the 2020s unlock? Well, we set out a few requirements for what we thought this ideal bioreactor and bioprocess should look like. First, it should be autonomous. Right? We have self-driving cars. Why not self-driving bioreactors? Second, it should be scalable. It shouldn't take any more years to take a bioprocess from the lab to commercial reality. We need to have downstream in mind, right? We can't just solve upstream processes. These need to be end-to-end affordable processes. For biotherapeutics, we need to be able to produce complex glycosylated proteins. This system should be resilient. It should be able to be done locally. It should be able to be done in the US on simple, reliable inputs. It needs to output a process that is repeatable with low variability. And lastly, ideally, we could do all of these things without compromising on cost. And if that seems like too much to ask for from a single system, well, I'm excited to say that we believe we have now built this bioreactor. We believe we have built the bioreactor of the future that is all of these things. And so at SynBioBeta 2026, I am pleased to introduce, or in this case, reintroduce to you all the chicken egg. At Neion Bio, we produce medicines inside chicken eggs. We use chickens and chicken eggs as bioreactors to manufacture pharmaceuticals. The way this works is we genetically engineer chickens so that they lay eggs filled with therapeutic proteins, and then we crack those eggs and we purify out the proteins. We replace every part of modern bioprocessing, from the filters to the pH sensors to the media components to the bioreactors, with a chicken. We essentially farm medicines. To make that a little bit more concrete, we can produce the global supply of a blockbuster biologic like Humira with a tiny farm that would fit inside this room. Right? We can produce the global supply of every biologic on the market today with less than 0.01% of the chickens farmed in the United States every year. And that staggering statistic is possible because at the end of the day, biologics are proteins, and chickens are the best protein factories on the planet, honed by 200 million years of evolution and 3,000 years of breeding. We simply co-opt these edible protein factories into being medical protein factories. The upshot is a fully autonomous bioreactor that is not only autonomous, but self-replicating. We have eliminated the scale-up problem in biology. A chicken lays an egg a day, 1,000 chicken lays 1,000 eggs a day. We can scale up faster than traditional CHO processes. The egg white is a simple, clean purification matrix, making downstream processing simple. Chickens produce complex, human-like glycosylated proteins. This entire system runs on chicken feed and water. Egg-to-egg variability is extremely low compared to a fed-batch CHO process. And of course, we are doing all of this at the cost and scalability of egg production. This is a 10x reduction in COGS, a 100x reduction in CapEx. These are chicken farms, not bioreactor facilities. To me, agriculture was the first great success story of synthetic biology, in which we harnessed a tiny sliver of nature and used a cutting-edge technology, artificial selection, to turn that sliver of nature into the powerhouse that produces all of the edible protein on this planet at incredible scales and costs. Our vision at Neion Bio, which we share with many people in this community, is that the farms that produce the food in our grocery stores could also produce the medicines in our hospitals. And this is no longer hypothetical. We now have over 5 products in development. We've just emerged from stealth with our first large commercial deal with a large pharma partner to bring multiple biotherapeutics to market. And we are here at SynBioBeta to say that we are growing rapidly. We are open for business. We want to work with you. We want to develop and supply your proteins at scale and at cost. We make everything from monoclonal antibodies to peptide fusions to enzymes to blood proteins and everything in between. Whether you are in biosimilars, novel therapeutics, animal health, or reagents, we want to develop and supply your proteins. Come find me or my colleagues here at this conference if you want to work with us. Reach out to us at info@neonbio.com. Our team is rapidly growing. If you are a world-class engineer or scientist, please come find me, reach out. I'm Sam Levin, and this is Neion Bio. Thank you.